Month, everyone. Um, as I had mentioned before, while we are getting started here, it would be great if people could click the chat button at the bottom of the screen and just let us know your name and where you're calling in from. We're about to get started. We've got an exciting issue to cover today, as well as two very special expert guest panelists. But before we get started, just a few reminders, and I'll introduce myself since I'll be acting as the host for today's chat. Just a reminder that you do not need to have your cameras on for today. Only myself and the presenters will have the cameras on. Please mute your lines. Also want to mention, as you probably just heard, this meeting will be recorded, and the recording as well as materials are going to be shared after with all registrants. Closed captioning is also available, as you've seen in the chat. All you need to do is click the CC Live transcript icon on your screen, and they should pop up for you. If you have any questions at any point during this chat, please feel free to click that chat button again and just ask away. We do have grassroots staff that are monitoring the chat box so that can help answer any questions or concerns. And I do want to make sure that everyone is aware we will have dedicated time at the end of this for you to ask questions to the experts. You can do that through chat, or if anyone is brave enough, they can come off mute. Totally up to them, but that will be at the end of the program. So for an introduction, my name is David McGoldrick, and I am the Federal Grassroots Manager. I manage grassroots campaigns and year-to-year engagement at the federal level through work with the United States Congress and related federal agencies like the Food and Drug Administration. With breaking news, we just have a new commissioner of. He is a longtime AHA volunteer and a cardiologist, Dr. Robert Califf. That vote just happened in the Senate, so that is literally breaking news. But we also work with other agencies like the United States Department of Agriculture, et cetera. So I'm excited to be here with you and our special guest today, because this topic, as I'm sure it is for many of you, is very personal, and it's also very appropriate for Heart Month, and that's cardiac rehabilitation. Specifically, during this chat today, we're going to learn about the federal legislation that could increase participation in life-saving cardiac rehab, as well as learn some new skills and how we can become a more engaged advocate on the issue. So I mentioned that this issue is personal for me, and I did want to share that with you. The reason why this is so personal for me is that I've actually had 3 members of my family participate in cardiac rehab programs, and all of them have benefited greatly from those programs. Most recently, after my father had 4 stents inserted in early 2021. So the skills that he learned during those sessions have really set him up and 2 other members of my family for longer and healthier lives moving forward. And as a member of his family, I can see every day how he continues his rehabilitation at home without supervision, that these programs that he had access to really were incredibly important and incredibly helpful. So I want to personally thank you all for taking time out of your day to talk about this important issue and for allowing me to share that personal story. So with all that being said, I know your time is valuable, and I do want to have plenty of time for our guests and for questions. So I'd like to go ahead and introduce our first special guest. His name is Josh Roll. He serves as the Government Relations Manager with the American Heart Association's Federal Advocacy Team. In his role, Josh works to advance our federal legislative agenda on Capitol Hill around healthcare access issues, including increasing access and participation in cardiac rehab. So Josh, welcome, and thanks very much for joining.
Thanks for having me on the call today, Dave.
All right, so let's jump in here. Just a few questions for you so we can get an understanding of what we're talking about today. Can you tell us a bit about the bill or piece of legislation that we're here to talk about? Specifically, what does the bill actually do, and why do we want it to pass, and how do we kind of get into this position?
All right, so the bill I'm here to talk about today is the Increasing Access to Quality Cardiac Rehabilitation Care Act of 2021. This legislation was introduced in both the House and Senate last year and enjoys support from both Republicans and Democrats in Congress. As the name of the bill suggests, this bill would help increase patient access to critical cardiac rehabilitation services. Now, for those who are unfamiliar with cardiac rehabilitation, or cardiac rehab for short, cardiac rehab is a medically supervised program designed to improve your cardiovascular health. If you've experienced a heart attack, heart failure, angioplasty, or have heart surgery. It includes exercise, counseling, and training, education for heart-healthy living, as well as counseling to reduce stress. Participation in cardiac rehab lowers the risk of death and health complications for patients who have had a cardiac event or heart procedure, and reduces the likelihood of a hospital readmission. Meanwhile, it also boosts the chance of returning to an active lifestyle sooner compared to those who do not enroll in a cardiac rehab program. Now, despite these numerous benefits, overall participation in these programs remain low, notably so for those who are enrolled in Medicare, our nation's seniors. Many cardiac rehab programs face capacity issues, especially those located in rural and underserved areas of the country. And in other cases, it simply takes too long for patients to be referred to these programs and for their treatment to begin. The data on this is pretty clear. The longer it takes for someone to be referred to cardiac rehab, the less likely they are to take that first step to actually participate. To help make these programs more accessible, this bill would allow additional providers such as physician assistants, nurse practitioners, and clinical nurse specialists, referred to as collectively advanced practice providers, to both order and supervise a patient's day-to-day cardiac rehab care, starting as early as this year. Oftentimes, these provider types serve as the primary care providers for patients. And in some cases, we've heard, an ordering physician may not have a relationship with the patient and actually rely on the recommendation of a nurse practitioner, physician assistant, or clinical nurse specialist to order cardiac rehab services. In too many cases, these requirements create obstacles, delays, and unnecessary paperwork before patients can receive rehab services that are needed on a timely basis. These important provisions would help increase patient access to these vital services, address program capacity issues that have been exacerbated by the COVID-19 pandemic, and reduce the time between referral and starting cardiac rehab, especially in those underserved and rural communities that face provider shortages. One thing that we have working for us is that Congress has previously recognized this is an issue and passed the Improving Access to Cardiac and Pulmonary Rehabilitation Act as part of the Bipartisan Budget Act of 2018. However, due to budgetary constraints, they pushed out the start of these changes to 2024. The legislation we're talking about today would make these changes this year and help ensure more patients can access these programs sooner than later.
That's very cool. Thanks very much for that, Josh. And I mean, I think we can probably all agree that this is just good public policy. They've already said it once. Everyone agreed to it before. Let's get on the path to making it happen earlier now. So I want to switch a bit and focus on kind of the political realities in Washington, D.C. And kind of why we chose to talk about this issue today. I mean, for those that don't know, in your role, you are working with lawmakers and Hill staffers on a daily basis. So can you share a little inside information on maybe what you're hearing in these meetings and why now is the time for grassroots to get involved in this issue?
Yeah, so I would say for the most part, what I'm hearing is overly positive. The key House and Senate committees with jurisdiction in this space recognize that this is an issue that needs to be addressed. And there is certainly agreement on both sides of the aisle that arcane and outdated Medicare laws should not be a barrier to participating in cardiac rehab, and that action is severely needed to address, the low participation rates we see all across the country. The other thing I'm getting from my meetings is honestly a sense of urgency. Right now, Congress is on the verge of passing a short-term spending bill that will fund the government through March 11th. And this sets up a larger omnibus funding package that would fund the government through the fall of this year and also address a multitude of bipartisan priorities. Often these must-pass packages are vehicles for other pieces of legislation. And oftentimes, in order to get support, they have to be bipartisan. So if I can convey one thing here that I'm hearing is time is of the essence. Discussions are already happening around what will be included in this much larger March funding bill. So now is the perfect opportunity to act and urge the inclusion of the Increasing Access to Quality Cardiac Rehabilitation Care Act.
That's very interesting. Really appreciate that kind of inside information there. It sounds like we do have an opportunity to make this happen, but that in order for that to happen, we're going to need to be very vocal, active, and engaged in order to succeed. So with that in mind, is there something that you want to ask of the people on this call right now? And it's something that might help you lobby in support of this bill?
Absolutely. And I think we have a slide that has some information on this. So to help in our efforts to get this bill over the finish line, you can ask your lawmakers to help increase access to cardiac rehabilitation programs by supporting this bill. And you can do that by texting rehab, that is texting rehab to 46839 to take action right now. And I would just say, let us know in the chat when you've completed the action. It should not take longer than a minute or so. And this is really critical. I mean, it's another thing I keep hearing in these meetings is that we want to hear from people, want to hear from advocates. So again, text rehab to 46839 to take action right now.
We'll just give everyone just a minute or two to take that action. And as Josh said, all you need to do is text rehab to 46839. You will instantly receive a link for how you can take action. You're just filling out your name and address, about as easy as we can make it for you. So we hope that you'll take the time to do that for us. And please, as Josh said, do let us know in the chat when you've had a chance to take the action. And additionally, if you do have any questions that you want Josh to cover at the end during our dedicated time, feel free to put that in the chat now, because we can always go back and find that for you. All right, I'm starting to see that some folks have completed it, so thanks to everyone. And in the meantime, you can certainly still keep doing that. But Josh, I just want to thank you for joining us today, sharing some of that inside information, and just reminding everyone again, if there are questions for Josh, we can definitely address those during our time at the end here, so feel free to put them in the chat. So I'd like to kind of build off that action that we all just took here and learn a new skill from our next expert guest. We're incredibly fortunate to have her with us today, and that guest is Arielle Beer. Arielle serves as the Federal Media Advocacy Director, and in her role at the AHA, Arielle supports the organization's federal advocacy priorities. This includes working with advocates like you to amplify your stories to Congress, the executive branch departments, agencies. So welcome to our call, our chat, Arielle, and thanks so much for joining today.
Thanks for having me, Dave.
So I guess let's just jump right into this. Arielle, can you tell us a little bit, we've seen your title that you're the Media Advocacy Director. Can you tell us a little bit about media advocacy and why it's so important to our efforts?
Yeah, absolutely. So we can use media advocacy in so many different ways through a number of channels. Simply put, media advocacy means trying to influence decision makers through the media, whether that's in newspapers, on television, or on the web using blogs or social media. And media advocacy is so important to all of the advocacy works that we do, because it is a way to highlight the issues and the problems that advocates, just like everyone on this call, are working to fix, and even possible solutions that could be implemented. So overall, the goal of media advocacy should always be about getting the issues that you care about into or onto the channels that your lawmakers are reading, watching, or listening to.
That's very interesting. Thanks very much for sharing that. I know some of us aren't necessarily sure what it actually means, but that's very helpful. So building off that, what are some of the examples of ways that You're the Cure advocates can get involved in media advocacy?
Yeah, there are so many ways that everyone on this call can get involved in media advocacy efforts, depending on your skills and your comfort level. And for starters, just like you texted rehab to that number, would love to see everyone on this call follow Amheart Advocacy on Twitter. I think you see it there on your screen, and You're the Cure on Facebook. So would love to see in the chat who is already following and who just followed. So that's where we're sharing updates with our network and opportunities to engage in the issues that are important to you. And on the topic of social media, it is such a great platform to share your message with a wider audience. You can use platforms like Facebook, Instagram, Twitter to not only reach other advocates and spread the messages that you want to about heart disease and stroke, but to also garner the attention of your representatives here in Washington by tagging them in posts and calling on them to take action on legislation that you care about. Another great way to get involved in media advocacy is by sharing your own story in the media. So this can be through interviews or by authoring an op-ed or letter to the editor. These are all great tools that give legislators, journalists, and members of your community a chance to learn more about your cause, form their own opinions, and ideally take steps to get involved.
So that's very helpful. I appreciate that. We heard mention of LTEs and op-eds. So in general, what would you say is the difference between an LTE and an op-ed, and when should advocates choose to do one over the other?
Yeah, so I think the easiest way I use to differentiate between an op-ed and a letter to the editor, or you will start hearing me call them LTEs, is that op-eds tend to be more proactive. So you're kind of deciding the timing, and letters to the editor can be more reactive in nature. So an op-ed is a written piece published in a local, regional, or national media outlet that expresses an opinion on a certain issue, while a letter to the editor is a shorter letter sent to the editor of a publication about an issue of concern or in response to an article that was already published in that paper. It's always important to think about timing and what your goals are when deciding between an op-ed or an LTE. As I said, letters to the editor are typically in response to an existing story, so timing is of the essence. And you want to submit a letter as quickly as possible for the best chance of it being published. Op-eds also really need to be timely, but you have a little bit more flexibility. You should think about what is happening in the news or on Capitol Hill and when your perspective would be the most impactful. So for instance, let's say we're getting close to a vote on the cardiac rehab bill that Josh was talking about, and you want to make sure that your member of Congress will vote yes. An op-ed is a great way to tell your own story and call on all of Congress or even your individual member to pass a bill.
Okay, got it. Thanks. And I will say I do love seeing one of the examples that you have there from an op-ed from one of our rock star advocates in North Carolina. One of our big issues, protecting patients from surprise medical bills. It's great to see that she took the time, did it, and was able to get it published. So great example of media advocacy in action there. So I do have a bit of a longer question for you now. And it's kind of, are there any tips that you have for folks on the call for how to write their own compelling letter to the editor or op-ed, or is there maybe some sort of guiding template or formula that we can use to make this easier for the advocates on the call and across the country?
Yeah, absolutely. So as you saw on the previous slide, there were a couple of examples of, I think it was a Washington Post op-ed and an Atlanta Journal-Constitution letter to the editor. And so the first thing you should always do when you are working up an op-ed or a letter to the editor, even before you start writing, is to check your newspaper submission guidelines. Most news outlets have very strict guidelines on op-eds and LTEs, including word count. So op-eds, as I said, are typically longer, 500 to 700 words, and letters are much shorter, typically a maximum of 200 to 300 words. So you'll see on the slide there what the typical guidelines or instructions look like. There can also be specific directions on how to submit, whether it's via email or via an online form, what contact information you have to include. One thing I always note for advocates is if you have to include any personal information like your mailing address or your email, it is typically just for verification purposes and it won't be published. It's just so they know that you live in their area. So you can typically find this information on the opinions page of a media outlet's website. And then we get on to writing. So your story is so important and a great way to personalize an issue. You should try to answer a few main questions when you're starting to write an op-ed or a letter to the editor. So why is this issue important to you? Why is it important to the people in your community? And why should your lawmaker care about this issue? And I think all op-eds and letters to the editor can follow a very similar template. First, you introduce yourself and the issue, talk about the issue, and insert an anecdote about your experience on the topic and how a policy or piece of legislation would help you. And it is good to always end with a strong call to action. So what do you want the people reading to do with the information that you just shared? Some other things that I always like to keep in mind when writing an op-ed and a letter to the editor are write like you talk. You are the expert in your own story. And so avoid jargon, fancy words, slang. You want your piece to be easy to understand, especially for people who may not have existing awareness of the issue. And you want it to sound like it's coming from you. The second thing I would say is always get to the point. We already talked about that there are word maximums that you need to keep in mind. So make your key points early and often and back them up with the facts, data, and examples. This is even more important when you're talking about letters to the editor because you typically don't have a lot of space. So you need to keep those short and concise. And then you'll see in a lot of guidelines that you need to include your own headline. So try and think of a short, snappy headline for your op-ed. This gives readers a preview of your piece, of what your piece is about, and grabs their attention. So overall, that is a lot to keep in mind. And I know that for people that are doing this for the first time, it can be scary to put your name out there. So just keep in mind that the media advocacy team is here to help. And we are always looking for ways to get the Cure stories out there. And we want help us help you. So if you have a story you're wanting to tell, please reach out to Dave or me. We may have an opportunity for you immediately. And if not, we'll likely have one down the road.
That's really helpful. Thanks so much for taking the time to share all of that, Ariel, for being our guest. And I put it in the chat, I did want to remind everyone that we will be sending a copy of these slides, some talking points on cardiac rehab, the issue itself, and the recording of this chat. So, don't worry about taking notes or any of that. I was also hoping that one of my colleagues could put my email address as well as the advocate@you'rethecure.org email address into the chat so that everyone has that and knows exactly how they can contact me. So again, thanks so much for joining us, Ariel. And I know I promised everyone here that there would be a Q&A opportunity at the end. So here we go. Josh, if you could join us once again, please come back on camera. That would be great. I imagine that we do have some questions in the chat for probably both of you here, or folks can't come off mute, but Betsy, if you wanted to kind of lead us here and see which we need to be answering first, that would be super helpful.
That is great, Dave. We did have one comment in the chat about mental health providers in ordering cardiac rehab. I do think one of the other volunteers have answered that, but you might, let me just read that to you. I've got to scroll back a moment. Steve wrote to say, I didn't hear any mention of mental health providers included in the type of providers for cardiac rehab. Is it intended to include mental health in the legislation as part of cardiac rehab?
So I will just say Lynn Braun did a great job of answering the question. While mental health services are very important to the CR rehab team, advanced practice providers are trained in acute and chronic care of cardiovascular patients, and the bill specifically addresses, ordering and supervising day-to-day services. And so the intent is to allow providers who are very familiar with these programs to be able to order and supervise. So that's why it does not include mental health providers.
Thanks so much. Other questions from anyone? You can either type into the chat or come off of mute and just ask your question.
And I believe all of our contact information was put into the chat if you do think of anything in the next hour, tomorrow, whenever it is. But in the meantime, we've got our experts here. If you've got any questions, now's your time.
While we wait, Dave, question for Ariel from me, something that maybe, everybody is out on social media, on one platform or the other, and there certainly are lots of media personalities also out there. So I, for one, big fan of Ginger Z and follow her all the time, and David Muir and some folks. And just wondered about the opportunities that people might have to sort of engage with the media that way, because they may be paying attention to their feed, and just wondered what tips you might have for our callers today.
Yeah, so I mean, it's such a good point. The media is absolutely all over Twitter 24 hours a day. And, something to keep in mind is in this 24-hour news cycle, a lot of the time reporters are looking to break news on Twitter, and then, of course, follow it up with a longer form story. And so one way that I like engaging with reporters on social media is just by if I see a story that I find really interesting, tweeting it out and tagging them and thanking them for their coverage of a particular issue. I would also say, as you find reporters that you think might be interested in the work that the AHA is doing, feel free to flag those for me. My team is always reaching out to reporters that are covering those issues, and so much of the time, the reporters love to talk to someone on the ground, a patient, or someone with, real hands-on experience on the topic that they're covering. And so the more we know about those stories, the easier it'll be for us to connect those reporters with advocates.
That's great. Thank you, Ariel. We do have a question that came in, Dave, in the chat from Ruchi. Is there any resistance to the bill? What are their concerns so we can help develop counterpoints? So this is for you, Josh.
So the only resistance I've gotten so far, and it is kind of the reasons why, and I alluded to it a bit, why, why when that bill advanced in 2018, why it didn't take effect immediately is cost. Estimates for this bill are that it will cost in the realm of 50 to 80 million over, I think, 5 years. That's a kind of while that seems like a lot of money, it's a drop in the bucket compared to the 776 billion that is spent on Medicare annually. So kind of the pushback to that is, the average hospital stay costs Medicare $11,700. It is much less costly for someone to participate in cardiac rehab, not have a lower chance of being rehospitalized, and ultimately save Medicare money. Further, we see that health systems save on average of 5,000 to around 10,000 per year of life saved. So again, the benefits somewhat outweigh the cost here. It's just not always so easy to quantify that in congressional terms, and how CBO, the kind of official congressional budget scorekeeper, they don't always score the savings as they score the cost to a bill. So that's been one barrier. But those stats are widely available on hospitalization costs, almost $12,000. Health systems save significant money, and as we know, the data shows cardiac rehab reduces hospitalization. So that's one that you can certainly cite.
I think that's really great insight there, Josh. Thanks very much for answering that. I don't see any additional questions at the moment. Again, just reminding folks that you can always shoot me an email with them and we will track down that answer for you. So again, knowing that your time is valuable here, I want to get you out on time. I want to close by saying thank you, all of you, for joining us today. Thank you, Ariel and Josh, for being our guests and lending your voices to this. To all of our attendees, thank you so much for all that you do for the Heart Association and for Year to Cure. It's Heart Month, so I think it's incredibly important to make note of all that you accomplished and put your time and effort into for us. So I want to let you know that your voices truly do matter, that your efforts are what allows us to be as successful of an organization as we are, and we really could not do this without you. So thank you again for joining today, for all that you do. Have a great rest of the day, and I hope you to see at our next Relentless Together chat in the coming months. So thanks, everyone.